All right, everyone. Welcome back to another episode of Filling the Gaps with Dr. Phil Dieter. I got a special guest with us here today, Dr. Kim Thor Adams. Her and I are just coming off of the Wave event, and was her presentation was outstanding. Love the energy, love the enthusiasm. So I was like, hey, I gotta bring this lady in front of the audience and just have her share a little bit about who she is and what she does. So could you give us the 30-second interview or the 30-second introduction?
Yeah, thank you for saying that. I had so much fun at the Wave. It was my favorite time ever speaking. I'm Dr. Kim. I'm a second generation chiropractor, born and raised in Nebraska. Thought I'd never move back home. Here I am back at home. I love that there's a chiropractic school in Nebraska now. I grew up unvaccinated. We never wore a mask. My kids never wore a mask. I'm a big fan of standing up for your rights. My favorite patient is 4 hours old. I like to get to the patient before they even know there's a problem. I often market, bring your baby to the office on the way home from the hospital. It fills up my cup and makes me want to make the world a healthier place.
That's awesome. So where did your dad graduate from?
From Palmer in 85.
Okay, my dad graduated from Palmer, and I think right around 74, 75. So that we have that in common. It's always interesting being the kid on the playground when your dad's a chiropractor, huh?
It sure is. Things are a little bit different in a good way.
Absolutely. It's one of the things that I feel like has really created that instinctual just like desire to, elevate the chiropractic profession and bring chiropractic to anybody and everybody. So, I know you, like you said, you work with a lot of kids and you've really developed that aspect of your practice. Um, that you already mentioned. One thing that I wanted to talk about is how do you make people more aware of the fact that you see kids? So I guess just asking them is probably one of the first steps, right?
Yes, asking them. Yes.
So tell me, let's just kind of start like if the new practitioners that I work with, the students. So you're on the faculty at Omaha, you said, at
Well, I
Bellevue?
pop in as a guest speaker every quarter. I have some friends that are teachers.
Cool, cool. Because I want to get out there to that campus. I've been around Life College since I was a little kid. Got to hang out with Dr. Sid and Dr. Nell. So the fact that we have a campus now there is awesome. So
Yeah, it's super great. I went to Palmer in Iowa because I'm in Nebraska, and I think having one in the state is a really big deal.
yes, I totally agree with you there. So, but let's talk about kind of first steps, or what would you recommend if somebody wanted to start seeing more kids? Like, I really don't have much experience working with kids. Maybe I'm a little scared or I'm a little intimidated. What's the first thing that comes to your mind when if somebody were to ask you that?
Yeah, I would say step one, get out of your own head. Okay. It's a spine. So if you're adjusting people, you should be used to adjusting a spine. In the babies, it's still a spine, same segments. You
Yeah.
might be in a little bit more pieces, especially in the pelvis. But if you are a specific and a thorough chiropractor, which you should be, you have to be a little more specific since their segments might still be in pieces, but it's still the same spine. If you're not already adjusting babies, sorry, not sorry, shame on you. You should be. When you get any patient in your office, whether they're a parent or a sibling or a cousin or an aunt, they know babies. And I
Yeah.
prefer someone to bring everybody in the household into the office to take care of the whole family. Sometimes I have 6, 7 people in a room and make it a party because if you're not instilling education with your communication into the patient as to why they should bring everyone in their house, that might be a good place to start.
All right. Well, let's say maybe some of these new practitioners don't feel like they got the education in analysis, necessarily analysis and adjusting. Let's just talk about that first. Like, I don't really feel like I've gotten much, experience or exposure to how to analyze a baby for subluxation, or then how to maybe adjust that subluxation appropriately. What do we do then?
Sure. Yeah. Like 2 weeks into practice, it was a little more scary for me than it is today, 17 years later, of course. I feel like with time, my adjustment gets better, of course. And with time, my assessment also gets a little less complicated because a lot of it, honestly, for babies is a visual assessment. Can they
Sure.
turn
Okay.
their head? Is one arm not moving as much? How's the range of motion? How's the eye contact? If you push and wiggle them, do they have a reaction? A cervical compression test. Does that light them up? Can you find their reflexes? Those are all simple things. Then Palpation and history are huge too. If there's any yellow flag, let alone orange or red flag in the history, explore it thoroughly. You have to have a green light, no yellow or orange or red flags to adjust them, and then don't hold back and adjust them. The way I adjust babies is a little different than some other chiropractors. I'm kind of a nerd about it. I'm a big
Okay.
Gonstetter in practice, so I really like those angles and those torques, and that line of drive, if you will. And I
The extra
interpret that.
something.
Say it again.
The extra something.
Mhm.
The adjustment
And
with
if
the extra something, the counterclockwise torque.
Yes. Honestly, and adults that come to me from other chiropractors, a lot of the times it's a SAL or an SAR sacrum that they're missing because the Z axis is the most specific and complicated. And if that's not checked, they come to my office. But with a baby, if you're using those angles, a lot of times the rotation and the lateral bend will give you a window of opportunity to adjust them without much force. If you're specifically in the very right spot with the right angle, it's an easy adjustment because you don't want to induce a force like you would into an adult necessarily.
So you're almost talking about like, because I'll have these moments when I'm sitting somebody in a chair, let's say to do a Gonstead seated cervical adjustment, where I just put them right in the right spot, and it almost
Yeah.
moves before I even thrust.
Or you get a
So
facet
is
kiss before the whole thing goes through. Yeah.
so that's the concept that you're talking about right there.
Yeah, and my brothers and I used to play ping pong when we were little, and sometimes when you hit the ball and you feel it come away from the paddle, you don't necessarily feel the like you would in an adult, but you feel, a stressful tension that's not there after the fact, if you're very in tune
Like
with it.
that.
At least I do.
I love that concept because I can relate to that even like in adjusting patients just in general. Have you had much experience with like doing the test where you basically hang the baby upside down to see what side the head falls to and that type of thing? Are you an advocate of that or
I mean, I learned that in college, sure. I
yeah?
don't do that. I
Okay,
Having someone who knows nothing about chiropractic bring you a baby at 2 days old is a thing in itself, and I feel like
sure.
my assessment with time is good enough that I don't have to do that.
Because I did see you were analyzing a baby on some of the videos that you had up on stage and that type of thing, and you were like you said, you were pushing the baby, watching to see would it turn its head to the left, head to the left. Is that what we were talking about in terms of that analysis piece?
Yeah, I can do that part visually sometimes without even touching the baby. So you walk in, and if a tiny baby's in the car seat like this, you ask the mother, does the head always look like that or can they
Right.
turn it? And sometimes it's just positioning. But if they say, oh no, their head's stuck that way, then obviously your analysis needs to go a little further. Or if the baby is just kind of floppy, then you almost wonder about something wrong. Or if they're too rigid and they're always arched backwards, how the mother holds them, if they don't prefer being held, if they won't ever stop crying in your office. Those are all visual cues you can have.
Excellent. Excellent. So let's shift gears. I really appreciate that. I'm sure there's a lot more to learn, and I'm sure we can talk about how people can connect with you too, and that kind of thing. And I know you got a big event coming up in Florida soon, so I wanted to really make sure I let people know about that event as well. But let's talk about how you make people aware of the fact that you take care of kids or you want to take care of kids. I know you already mentioned that the first step sometimes is just saying to the parent, hey, how if on your way home, bring the kid in, kind of thing. So, can you give us some tips and ideas and tricks that you've used? Maybe not tricks, but things that you've used over the years to create more awareness for taking care of kids.
Yeah, I'm kind of loud on social media. So I assume in this day of age, especially if you're a new doc, you're probably better at it than I am because I'm
Yeah,
almost 44 now. So, but if you have social media, they say if you build it, they will come, but you have to tell them that you're there. And so I think it was 2011. I literally put up an iPhone on my tissue box. I said, hey, everybody, it's Dr. Kim. A baby that hadn't pooped in 10 days pooped. It works. Bring me your baby. And it was simple enough. See, it's seriously simple enough, specific enough that you
everybody loves a
almost
good poop
ask.
story.
I mean, when my kids don't poop for a couple days, they're crabby. I can't imagine these like 10-day stories of kids not pooping.
Yeah,
But anyway, like if you throw out to the universe, like, okay, when I'm 70, I'd like to own a yacht. Let's say that.
yes.
So I've got a few years for my, 26-year plan or whatever that is. So if I throw it out at the universe, I hope it just brings it back to me. on social
There you
media.
go.
If you throw out in the morning, I want to see constipated babies, and you're loud enough on social media that people see it, the phone will ring with that. But the best referral is a word of mouth referral. Always has been, always will be, when they walk in your office and already know you're great. So when you get, let's say you get that very first pediatric patient in your office, you better be asking things like sleep, mood, range of motion, poop, acid reflux, all of the things you can ask. And then you instill in them with the sleep and all the stuff that you can help with those things. So it plants a seed in their brain. Even when they're older, I'll say mood, energy level, sleep, bathroom habits. Like I want to know how their whole body is working, which implies that I can help their whole body work better because I can. And so the
Hmm.
very first pediatric patient you get, they'll see results and you tell the mother, yeah, I can't imagine babies that never go to a chiropractor. Feel free to tell all your friends. When they come back on the second visit and they're like, oh my God, my baby slept all night and the mom now has makeup on because she's not exhausted anymore. You can say, feel free to leave a Google review, or can I take a picture with you? Or would you mind if I added you to my blog this week? Anything you can do to get louder. But if that mom
I
then
love it.
goes to any mom's group of any kind and says, my baby slept all night because I went to Dr. Kim, then somebody's going to hear, and then the same trickle effect is going to happen. And eventually you'll get a lot of babies. You just have to be brave and bold enough to ask for it and have the proof be in the pudding with your skills.
Now, do you have anything like in your office? Like I know in my office, I have, right outside my room when I'm like moving someone to the front desk or something like that to get them checked out. I have a big sign that says, kids get ear infections. Have you ever had your child check for subluxation if they've had an ear infection? Like one of those kind of posters. I don't know exactly what it says, but something to that effect. Because I'm always waiting for them to be like, oh man, like stop and like glance at that. Because then I know that's my opportunity, like start building that conversation kind of thing. So do you have
Yeah, that's
anything
a good
like that in
idea
your
to have
office
stuff.
or brochures? I'm sorry.
Yeah. That's a good thing to have stuff around the office. I made a babies in chiropractic pamphlet and a pregnancy in chiropractic pamphlet. And yeah, you can take them around town and show patients. But I think the best marketing for me is having babies in the office every day. People see in my office that there's kids in here. And the landlord made my office very beautiful and very elegant. It looks like an art gallery, but it's super kid friendly. They can kick balloons and run around, and there's a chalkboard painted on the wall. And just the fact that there's a chalkboard in my office in the lobby that people can
Yeah.
see kids have been here it's enough.
Can you remember back to like your first weeks or months in the office? Did you say you went to work with your dad?
Yeah, 6 years I was an associate before I started my own.
Okay. Can you remember back to like those first weeks or months like working in your dad's office? And was there anything that you like did initially to be like, hey, I'm the pediatric chiropractor here or anything like that?
I never really set out to be a pediatric chiropractor because
Okay.
I wanted a yacht. So I wanted to help everyone. But I also didn't want to be crabby at bath time when I went to give my kids a bath. So I don't want to see 1,000 people a week. It was taxing on me. But so I just set out to see anyone. And I was in a group practice and a doctor was about to retire. So I was kind of taking over his people. But when I started to see families and then I would make the babies better, I realized that it filled up my cup of passion more than anything else, and I preferred it. So then I started marketing more for it. But I think the fact that the mothers, because there wasn't really pediatric chiropractic in my town at all, which I should have jumped on it sooner, but knowing that, but when you're fresh out of school, you don't have the gumption. But
Right.
the more babies that I saw and the more mothers that told other mothers, word on the street was that Dr. Kim does great with babies. And then I just took that and ran with it.
You just got to get out there. That's the take home mom and just get yourself in front of people. But I like that brochure concept. I always love those leave behinds, that way I can go to OBGYN offices and things of that nature. And, I even put together like a pelvic floor presentation because I taught pelvic floor anatomy for like 7 years at Life West and offered, OBGYNs, hey, do you want to use my pelvic floor presentation, and branded it and all that kind of stuff too. That's been a really cool little tool that I had as well that I built. If anybody wants that tool, happy to send you my presentation. Don't hesitate to reach out to me about any of those kind of leave behinds or anything like that. So, well,
Yeah,
I
that's
wanted
good.
you to, what's that? I'm sorry.
That's good. Like back in the day, I used to speak at breastfeeding support groups. I would have a
Yeah.
wellness moms group that met once a month. I mean, you have to create something or put yourself out there in specific ways for pediatrics if that's what you want.
Absolutely, and any patient population, right? Like the leave behind or the sharing your information, sharing your knowledge before ever asking for something, I think has been key for me, in building my practice over the years. So, well, I wanted to let's talk just a little bit about what else you're up to because I know you got this big event coming up in Florida. So, tell me what inspired you to create this event, what the event's about, and
Yeah.
what should people expect?
Yeah. So the theme of the event is brave, bold, and badass because there
Okay.
was a time where I wanted a room where I could raise my hand and say, wait a minute, what's going on in the world and in my family's life specifically doesn't resonate with my principles of natural health. And I think it's stinking ridiculous. And it wasn't enough for me to just make a video on social media or write 2 books like I have or speak on stages. I feel this burn of a divine assignment from God above as a second generation unvaccinated chiropractor to not feel like a leper or a lonely person the next time something would come around where I need to be more solid in my principles. I want more people standing bravely beside me. Now, bravery can mean becoming a cash practice. Bravery can mean seeing more kids if you're hesitant or scared to do so. Bravery can be telling the football coach that you really do need to see his players more often. It can be whatever you're lacking for fear, but I put together 24 of the bravest speakers I could. And I
Okay.
want them to share their personal stories as a human, as a parent, if so, and as a doctor of how they leveled up their bravery in the past 5 years and currently in practice, because there's going to be so many nuggets from those people to take away. And the other co hosts with me are Jenna Davis, who's huge with pediatrics, and Ara Tovar, who does mission trips
I
everywhere.
know
So
Ara.
there's a lot
Yeah.
of good opportunities going to be presented for hands-on pediatric things also. And it's going to be a good time. My 11-year-old made fun of me because it's November 6th and 7th. And she goes, 6, 7. Oh my God. So it's November 6th and 7th. Yeah,
The
right,
six
Phil.
seven,
It's
the
November
six
6th,
seven.
7th at the beach of Fort Lauderdale at the Westin. And the room is half sold out. I'm not sure if I can get the other ballroom too. Billy DeMoss says, like, how many are you expecting? And I'm like, well, I'm not sure we can cow jam it, buddy, but the Marriott down the street holds 600. So, in future years, that's my goal. But really, I made the event because I don't know what else to do with this burning desire of passion to make the world a braver place, specifically with chiropractors. So there it is.
I love that. That makes that fires me up right there because I think that's something that's been in short supply over the last well decades, but 5 6 years. I won't say 6 7 years, and yet, but yeah, I think that's if you're a young practitioner new in practice, you're looking for ways to build up your confidence and certainty. Get around that group right there. I can see now that makes way more sense about your mission, and that's awesome. I really appreciate hearing that. All right, so let's just kind of wrap up. I know that you do some consulting and that you stay. How do people stay connected with you if they want to hear from you? Get your
Yeah.
content, that kind of stuff.
Yeah, on Instagram, I'm Dr. Kim Thor. There's also a The Brave Practice on Instagram. The website is thebravepractice.com for the event. If you do a /home, you'll get my coaching company. We're in the middle of a Summer Bravery Series, and it's free if you have the promo code. Otherwise, it's cheap. It's like $47 for replays. The last one was on a cash practice mindset. So if you're done taking insurance or you already are done taking insurance and you just want more tips for a cash practice, that's what that was. The next one is the 26th, I believe, called Effective Communication, how to talk to patients, specifically pediatrics, cash practice, all of that stuff. And the third one is diversifying your portfolio. So I went to a small town girl chiropractor to being an author and a speaker, and now I'm hosting my own event. I do blogs and a whole bunch of stuff. So if you'd like to diversify your portfolio that way, that's what the third one is about. It's all on the website.
How do people get the promo code? Like how do they qualify for the promo code?
Well, I let the first ones in for free, so they kind of missed the boat, but I can make a new one. So we'll just put, what is your podcast called here, sir?
Filling the gaps, PHILLING the gaps. I
Okay.
try to
Well,
do a
I will
little
make a
play on. I
promo
got this
code.
gap in my teeth that people always give me a hard time about, so I could show you the gap. But I thought that, I keep thinking to myself, there's this gap between when you graduate to when you get out into practice and start getting going, and that's the where I'm really trying to help people is bridge that gap. So
So good. Okay, I'm going to make a promo code today that's called Phil, PHIL, capital
okay.
letters. So you guys can all go sign up for my Summer Bravery series for free on my website there. And I'll send you a replay for the first one and you can catch the second and third. And it's just a little bit of tidbits to help you in practice and encourage you to come to the event.
I love it. I love it. I really appreciate you being on today. This is exactly the kind of stuff that I want to continue to bring to my community and just to all of the students that have come through my classes. And I think it's a super important topic. So thank you so much for being with us today.
Yeah.
Any final parting words?
Yeah. So if at home you're making choices and decisions for yourself and your family to keep them healthy, and then you go to practice and you bite your tongue or you don't want to say exactly what you're doing for yourself and your family, you should be. If you're not living congruently and authentically. And the best way to take care of a patient is the same way you would for your own family, or you would be choosing that.
The very sage advice. And I think you guys will continue to get more and more of that if you can join her challenge, the Brave Challenge, right? That's what it's called.
The Summer Bravery Series, yes.
Summer Bravery Series. I'll make sure I put that in the chat notes correctly. Summer Bravery Series. I love it. So, well, thanks again so much for being with us. I really appreciate it. And I'm looking forward to the next time we get to be in the same room together.
Yeah, you too. Thanks for having me.
All right. Have a good day.
You too. Bye.